Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for speaking with us today.
Thank you very much.
Yes, sir. All right, so the adolescents vaccination program will be launched this afternoon. I just wanted to know your expectations and hope for this particular program.
Well, I hope that a lot of people come forward to start getting vaccinated, because it's the first time that we're able now to offer the vaccines for children between 12 and 18. So I really do hope that parents take the opportunity to get their child vaccinated. As you know, we want to open school on the 6th of September. So if you want your child to be safe and protected from COVID, then one way of doing so, apart from taking the regular public health measures, would be to get them vaccinated. And we are now offering this vaccine. We'll try to roll it out as quickly as possible. But when the vaccine comes in a community school or health center near you, please make sure that you come out and get the vaccine. Well, it's a very effective vaccine. It works. We have seen that literally millions of people would have received this vaccine. And in the children population in the United States, more than 11 million children would have received the vaccine. And they have, because they've gotten the vaccine, they're able to continue doing activity in a very safe way. So I want parents to understand that this vaccine is really protective of your children. And I really want them to encourage their children to get the vaccine. First of all, we have noticed that we have an increase in cases. So over the last week or so, we have had a steady increase in cases. So today we've seen an additional 152 new cases across the country. And to date, we have 1,695 cases that are active. So this is showing us that we have an upswing of cases, and we have to take extra precaution now. I think people had become a little bit complacent, not adhering strictly to the measures, not going out to get vaccinated, protecting themselves. So if there's any indicator that we need to become more vigilant again, I think this is it. Because apart from seeing more cases, we have also seen more hospitalization. Just 2 days ago, when we spoke about hospitalization, I told you we had 70 persons in hospital. Now we have 99 persons in hospital. We have 73 persons who are at the Ocean View facility. We have 7 persons at West Demerara, 2 at the Maikoni Hospital, 4 at Rose Hall, 3 in Skeldon, 4 in the Bartica Regional Hospital, and 2 in the Upper Demerara Hospital. So as of yesterday, we would have completed 306,906 persons receiving their first dose of their vaccines. That would be approximately 59.8% of our adult population. For second dose, we've had 158,557 persons who would have received their second dose vaccine. That now brings us to about 30.9% of our adult population.
Right.
So we have seen a constant increase in vaccination, but we are still a far way from herd immunity. We still have to work together to make sure that we increase these numbers, community by community, region by region, to make sure that we are protecting ourselves. No, there are two different types of vaccines. There are some common pathogens that would cause pneumonia, and that's why you have that vaccine specifically made for pneumonia. Coronavirus vaccines or COVID-19 vaccines are different. We have different types of vaccines, and they're specially made to fight the SARS-CoV-2 virus, which causes the COVID-19 disease. So the vaccine, if you take a pneumonia vaccine, it's not effective against the coronavirus. But if you take the coronavirus vaccine, then that would work because it's developed specially for this particular disease.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.